Will I be enrolled in Medicare automatically? Doesn't that just happen? I mean, I'm about to turn 65. Don't they just enroll me? So that's kind of the questions that I get all the time. And I'm gonna go through the two ways, the only two ways you will be enrolled in Medicare automatically. So let's find out if this is you. Hey, so if you're new here, this is Medicare Media USA. This is where I kind of go over the ins and outs of Medicare. But if you are looking for the full length Medicare 101 webinar, there is a registration down below the link. It's free. Check it out. It goes in depth. So today, I'm mainly just going to talk about. Are you one of the ones who gets automatically enrolled in Medicare? Like I said in the very beginning, there are only two ways. So let's go ahead and tackle the first one. So the first one is if you are already taking your Social Security at least 4 months, 4 months before your 65th birthday month, then you'll more than likely be enrolled in Medicare automatically. I say more than likely because I personally think Medicare is still a little bit of the Wild West. So I see things go through that I'm just like, hey, cool, no penalty, onward. Then I see things that are like, whoa, 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 whoa. It must be like a green newbie going over your application. What are they asking for? So there are some things that go through, there's some things that don't. So let's just put it this way. If you are drawing your Social Security the 4 months before your birthday month, and let's just say it is 2 months before your birthday month and you haven't seen anything yet, then you more than likely need to apply for Medicare. Maybe your application or your name got lost in the system. So you can imagine, just imagine it this way. Uh, you're taking your Social Security income. Maybe you started drawing it at 62, 63, 64. This means you're kind of already in the system. And so they will automatically but enroll you in Medicare. But let's just say you're like, whoa, whoa, whoa. I actually have group insurance because I am still working and I will continue to work till my full retirement age. Well, what if I kind of don't want Medicare? Well, that's okay. Just turn the card around or turn the letter that you get that says, hey, you're enrolled in Medicare. Here's your card. And there's a way to disenroll in Part B, as in boy. Can't really disenroll in A, but don't worry about it. That part's not going to cost you anything, anyways. That's the hospital part. B is the doctor, the outpatient part, which your group coverage is going to take care of that. But do not disenroll in Part B if number one, you're on Obamacare, ACA, marketplace kind of plan. Number two, you think your Cobra insurance is credible coverage. That's a negative. Don't do that. You better stay with Part B. What is another one? The other ones, if you need TRICARE for life, you gotta have both parts A and B. Um, if you are a retiree, some retiree plans are not considered credible coverage. So you're that's where I kind of get on the phone with people and go through the weeds and in the details of everything. So if you're one of these people, seek help, whether it be me or whether it be your local agent. But if you know for sure you're on group coverage that has more than 20 employees, 20 or more employees, then you've got credible coverage in which you can actually disenroll in Part B if it makes sense. So, what I mean by that, if it makes sense, if you're paying close to nothing for your premium coming out of your paycheck every pay period, I just spoke to someone actually yesterday that says I pay $700 a month for my group coverage. I said, "Whoa!" She says, "Yeah, that's highway robbery. I want to get on Medicare." So it made absolute sense for her to get on Medicare. But I've run across people that don't pay anything for their group coverage. I've run across people that pay $40 a month for it. So it may make sense for you just premium alone. And most people are healthy. If you're hitting your max out of pocket every year, you might consider Medicare, staying on what you got automatically enrolled in. But to kind of put a cap on the point that I'm trying to make here, if you are taking your Social Security, you will get automatically enrolled in Medicare. If you would like to continue taking your Social Security, continue working, which that's not my realm of expertise, but you do know that you're going to more than likely, if you're taking your Social Security and working, you know that there is a cap on the amount of money you can make before they start taking money from your Social Security. Um, see your local Social Security expert for that, if that's something you're not aware of. But so going back, if you're taking your Social Security, you will get enrolled in Medicare A and B. It's just going to arrive in your mailbox, your red, white, and blue card. If you like to disenroll in Part B, you can just turn the card around and follow the directions. So, number two, the other scenario in which you are automatically enrolled in Medicare is if you are disabled. So those people who are under 65, you're like, how the heck did they get Medicare? Or, you got to uncle, or so sometimes it's family members who are already have their Medicare card that she's 42. How'd she do that? So when you draw Social Security disability and you're on disability for at least 24 months, 2 years, you automatically get enrolled in parts A and B. Now, it's clever to take A and B and then get yourself in an advantage plan. I say this because those advantage plans offer a whole lot more benefits than just A and B. They include dental, things like vision. You get some over the counter credits. Your copays are going to be lower, and your out of pocket is capped every year. So it's not just an 80-20 kind of situation, where Medicare pays 80 and you pay 20% with no cap. Those advantage plans are good to cap because there's only some states that will allow Medicare supplements under the age of 65. Me being here in Texas, I know Texas is not one of them. You can get a supplement plan A, but it's like Swiss cheese. It's got a lot of holes in it. So most of the times I am advising for someone to get into an advantage plan. Now, when they hit 65, that's another conversation. They are now they hit the 65 open enrollment. So they are allowed to then go into a Medicare supplement plan, without asking medical questions, without proving insurability. So that's a route that is also taken. So just again to kind of put a cap on the second way that you are automatically enrolled in Medicare is going to be if you have been on disability for at least 2 years. Arrives in the mail. So those are the two ways. If you have any questions, maybe pertaining to your specific scenario, that is so normal. And so just drop a comment. If you want me to talk about a certain scenario, drop a comment and like, comment, and subscribe if you've got anything out of this video. If you didn't, please don't. If you got suggestions, also drop that in the comments because there's so many ways that Medicare can be sliced, diced these days. And a lot of the times people are continuing to work these days as well to continue to work towards that full retirement age of, I don't know what it is now, 66 and 10 months. So tell me your scenario, what you got going on, and I'll see you in the next video.